Hi, everyone. I am so delighted to be speaking today to Dr. Victoria Maizes. She is a teacher, a mentor. I've known her since doing the Integrative Medicine Fellowship Program at the Andrew Weil Center for Integrative Medicine in Arizona. And she is also an author and has a book, Heal Faster, which we're going to talk a little bit about as well. And she's the executive founding director of the Center for Integrative Medicine, the Andrew Weil Center for Integrative Medicine. So welcome, Victoria. Thank you so much for being here.
I'm so delighted to have a chance to speak with you. Thank you.
Yes, so let's dive right in. I'd love to kind of, before we talk about integrative medicine and kind of how you use it to support your patients, I'd love to hear a little bit more from you about how you got into this field. What has your kind of career trajectory been like, and what moved you in this direction?
Yes, well, I've been a doctor for a very long time. And so I went into medicine with this tremendous curiosity about people's stories. And I was always interested in listening and trying to understand how somebody ended up where they were. And in the early years, when I began practicing medicine, I did primary care in Northern California. I had time with my patients. It was before the treadmill of medicine got so fast. And I had the chance to listen to their stories. And in their stories, I heard about them having acupuncture and going to a chiropractor and taking vitamins and following different diets. And I heard how, for some, these different therapeutic approaches made a tremendous difference. And so, along with my patients, I began to deepen my study of these different areas of medicine. And over the years, the treadmill of medicine got faster and faster, and I found myself quite dissatisfied with what I sometimes call fast medicine. I sometimes call Band-Aid medicine. It really wasn't getting to what you and I call the roots of the illness and the opportunity to help people fully recover, to restore their health and well-being, and not just use therapies that might manage symptoms or might suppress symptoms, but really help someone get healthy again. And that's ultimately what drove me to pursue a fellowship in integrative medicine at the University of Arizona, and then to become the director of the program.
It's so interesting how so many of our stories of us who find integrative medicine and practice it, how similar they are in certain ways. I also found myself practicing primary care in California. And in large part, it was due to patients who were coming to me with their naturopathic physician's recommendation or their acupuncturist, or very similar to you, and starting to investigate some of the supplements or herbs they were on and really trying to distinguish this kind of what is fad versus what is actually based on evidence. And then understanding how some of these therapeutic modalities are impacting them, and really kind of coming at it from this curiosity standpoint, because so much of the time when something is foreign to us, I think sometimes human nature is to be dismissive because we've heard about it, we haven't. And so I love that it was through patient coming to you that this really sparked this interest.
Yes. And I think what we both pointed to is this quality of listening. And sometimes in integrative medicine, we call it generous listening, where we're really listening to understand, as opposed to, how do I answer that? How do I respond to that? But because there's so many levels you can listen. You can listen to the facts of the story, but you could also listen to what's below it, which might be the emotions or the belief systems that someone has, their own self-image. I mean, there's a lot to this kind of deep listening.
Yes, it's such an art. And speaking of listening, actually, I listened to Esther Perel. I don't know if you listen to
I
her.
do. Yes.
So she's, for anybody, who may not know who Esther Perel is, she's a couples therapist, and also has a podcast, Where Shall We Begin? And so I sometimes listen to these sessions because It's so fascinating what kind of is underneath sometimes the statements that people make, and then how she kind of is able to really kind of pick that out and find it and sort of bring it out. And one statement that she made in an episode that I recently listened to was the role of the therapist is to meet their patient where they're at and accompany them to where they would like to go. And I thought that interestingly mirrors the role of the physician, and this kind of, especially this evolving role as we're going from this kind of doctor-patient relationship that used to be very much kind of an active on the part of the doctor, more passive on the part of the patient. That I think more and more people in the medical community, and certainly patients, are advocating for this more. There's more emphasis on that partnership and on that guidance. So I'm curious, tell me a little bit about kind of how do you see this relationship has evolved for you over time, and how do you practice in this context?
Yeah, it's funny. You're reminding me of a funny story. Many years ago when I was in primary care, I had this patient tell me very apologetically that she had referred her mother to another doctor and not to me because her mother needed someone who was just going to tell her what to do. And my style, which was partnering and working together in this collaborative way, was just not going to be a fit.
Right.
So yes, I think there's a lot of qualities of really seeking to understand what is my patient's preference, because in integrative medicine, we're lucky. We have a very large toolkit, and there's many ways to get from point A to point B. So just as an example, if someone has high blood pressure, you can offer them a wide range of strategies, especially in mild to moderate, not the severe high blood pressure. So they could make dietary changes. We know that the Mediterranean diet, the DASH diet, which is dietary approaches to stop hypertension, can help. There are some supplements that can help. Regular physical exercise can help. Mind-body tools and breathwork can help. Removing environmental toxins, which might be elevating their blood pressure, can help. So there's so many different angles, including medications, I should say, that can be the way in which somebody is going to approach it. And we have people with different preferences. One person says, wow, I've always been curious about meditation, or I'm interested in learning breath work. Another person says, Doc, I have no time, just give me the pill. So it's really working together to see what are our patients' preferences, where do they want to start, what have they done before? We may have 100 ideas about diet, and they're like, I've tried every diet in the world. Don't talk to me about diet, because they're frustrated. It hasn't worked well for them. And so another approach is going to be what's best. And I think this kind of inquiry, this kind of partnering, this kind of openness to move in different directions. And it doesn't work for everything. Somebody's having an acute heart attack. We're going to be directive. We're going to say, right now, I need to have you come to the hospital. We have to have you chew on an aspirin as you arrive. Call the 911 to pick you up. It's not for everything, but for so many of the ills that people face, which are chronic diseases related to lifestyle, this is really an awesome approach.
I agree. And I think that what I really, have seen over the course of my practice is that people often feel when they're not necessarily given options, or when it's not a dialogue, they feel that they're being dismissed, or they feel that simply, their doctor doesn't think their symptoms are important or valid, or like you said, maybe they're recommending something that just doesn't resonate with their belief system and value system. And I think that, as you pointed out, when we're dealing with acute, life-threatening situations, obviously that's a different approach. But when we're talking about this long-term health strategy and planning, and how are we going to prevent or manage or reverse chronic disease, there are so many different avenues to take, and you really don't know until you have that deeper conversation. Like with a patient with hypertension, it's a perfect example. I recently had a patient where we went through various ways to support the vagus nerve because we identified that, hey, maybe if you're in sympathetic state a lot of the time and your exercise, your diet, and everything else is excellent, but you're still in sympathetic, let's try and see if this works, before we jump to medication. And I think that you wouldn't know that if you don't necessarily take the time to inquire about these other factors.
Yeah, that's such a great example. I have been recommending strategies for many years to quiet the nervous system because you mentioned the vagus nerve, which is the most important nerve for the quieting side of our nervous system. So we're all familiar with the sympathetic nervous system, which is fight or flight or fawn or freeze. But fewer people are as aware of the parasympathetic, which is the quieting side. And many people in our stressful society are in this, what we call sympathetic nervous system overdrive. They're just in chronic stress. They're releasing cortisol. And we need that quieting side to be activated and to be a balancing function for the sympathetic side. And so activating your nervous system on the parasympathetic or the vagus nerve is key. And there are easy ways to do that, like singing, meditating, humming, breath work. Not so fun necessarily, but it works. Putting your face in cold water. And now there are these really wonderful new tools that activate the vagus nerve. And I've been using these vagus nerve devices, I bet you have too, that either directly work over the vagus nerve as it goes down the neck or sometimes on the ear. There's some, let's say, milder stimulation that you would put on the chest or on the ankle or wrist. And for many people, these are really wonderful tools to help them quiet their nervous system.
Yeah. I'm curious, actually, since you mentioned the vagus nerve devices, I'm curious if you've had experience with one being better than another or having more, because I hear these anecdotal reports from different devices and there is some research out there, but I don't think we have any comparative ones. And I'm curious if you've noticed any differences.
Yeah. So for your listeners, this idea has been around for quite a long time, but it began with what we call implantable. So they actually put a stimulating device in the brain for seizure disorder, for epilepsy. And that's been studied and can be very effective for people who have terrible seizures. We're not talking about mild, but we're talking about tens or hundreds of seizures a day, and usually ones that aren't responding to medication. All right, so that's a very invasive way to stimulate the vagus nerve. Much more recently, there's now one that gets implanted in the neck for rheumatoid arthritis. So also implanted, also quite invasive from that perspective. But it stimulates the vagus nerve, which not only quiets the nervous system, but also reduces the amount of inflammation in the body, which of course is the issue with rheumatoid arthritis. But along this research of the implantable, more invasive has been, well, can we do this superficially without putting it inside? So there has been research for some years now about one called GammaCore, which is stimulating on the vagus nerve in the neck. And they will teach you how to find the vagus nerve. And usually you stimulate it for 2 minutes on each side, maybe 2 or 3 times a day, depending on whether you're treating an acute migraine or working to prevent one. It's also FDA cleared for cluster headaches, which can be very hard to treat. So GammaCore, I would say, would be my top choice if you have cluster headaches or migraine, because it has enough data to have gotten FDA cleared. But I use these devices a lot for people who are anxious. And my favorites are one called Sensate, which I'm just going to be really clear. It does not have the same level of research. It just doesn't. But it's relatively inexpensive, around $250 for something that's going to last you for years. And you put it on your chest, right over your sternum, in the middle of your chest. And it vibrates and is paired with sound. And I have found this incredibly effective in the people I've recommended it to for anxiety, for people who have trouble falling asleep. I also have recommended one called Apollo Neuro. That does have studies, although not as extensive as the gammaCore, which is FDA cleared. So this is more been studied more in healthcare professionals, and it is worn on either the wrist or the ankle. It has different settings on it. It's also a vibratory tool, so not directly over the vagus nerve, but in other places. And the last one I'd like to mention is actually interesting because it's not necessarily just for the vagus nerve. It's called alpha stim, and it's put on the ear, and it probably also stimulates the trigeminal nerve, which is another one of the cranial nerves. And yet it has a setting for anxiety. It has a setting for pain. And so those are the ones I'm most familiar with. But really, there's more and more every day because people are enjoying having this tool to use, and it's non-pharmacologic, so it's much less likely to have side effect, not zero. I always like to say anything that can help probably has some risk for harm as well, but quite a bit safer than, for example, medicines for anxiety, which includes the antidepressant medicines and benzodiazepines, which are medicines like Ativan and Valium and Klonopin. So these are really wonderful non-pharmacologic tools that people can access.
Yeah, definitely. And I agree. There are so many out there. Another one that I'll sometimes use is Neuropod, which goes on the trachea. And they've done studies where they look at sham vagus nerve stimulation, which would just go on the earlobe. Because that's not innervated by the vagus nerve, and compare, and they do see differences in heart rate variability change, for example, which is a known metric of that parasympathetic nervous system tone. But it's really interesting. I tell people, some of my patients like to track their data. So if they're already tracking their HRV, if they already have a Woburn or a ring, it's a good thing to see, okay, well, let's see what are your averages before, what are they after? You can detect that interval change. There are different ways in which we can, I think, of course, assess how we feel, but also assess, okay, has there been an interval change with consistent use?
Yes, and I also use the wearables with my patients a lot. I use a wearable myself. And so, for example, if you're struggling with insomnia, which is so common, you can see if when you use a tool, and it doesn't have to be this vagus nerve, I often recommend Insight, like INSIGHT, Insight Timer, which is an app. It's a free app. There is a paid version, but the free one has more than 300,000 things to choose from. So you don't usually ever have to go to the paid version. And you could see if your sleep latency goes down. What I usually recommend to my patients is that they find something on the Insight Timer, or for example, personally, I use that Sensate when I'm going to sleep, and notice if their sleep latency, which is the amount of time it takes to fall asleep, is shortened. And so that would be another way of tracking. And these wearables give you the ability to do what we sometimes call N of 1 studies, where you do an experiment on yourself and you have some way of seeing, does it make a difference?
Exactly. Yes. And I'm curious, when you recommend Sensate, how long do you recommend that people use it for at any given session?
So Sensate has settings of these different length of how long the vibration of the sound is going to last, and they range from 10 to 30 minutes. And so the nice thing about the Sensate or the Insight Timer is when it goes off, it just goes off. So you may have fallen asleep. You don't have to turn something off. I mean, what I notice if I fall asleep, that at some moment I notice that Sensate has fallen off in the bed and I find it somewhere in the morning.
Yeah.
But it's not something that you then have to interrupt your sleep in order to turn it off. I also will sometimes use one of these devices when I'm flying, which is a time when I feel a little anxious, and then it quiets me down. And so typically the duration will be from as short as 2 minutes for the gammaCore to Apollo Neuro, which you could set actually for long periods of time. 30, 45 minutes, and it will vibrate on your ankle, for example, in a way that won't interfere once you fall asleep, but might help you get to that restful state.
Yeah, that's great. I didn't know about the Apollo, the ankle and wrist to that one. So as we started to kind of talk a little bit about anxiety, let's sort of extend the topic. That's, one of the things we kind of wanted to dive into. And as we said, there are so many options. We've covered some of the ways in which we can support the vagus nerve through these vagus nerve external devices. And that promotes that parasympathetic, calm, rest and digest state. Tell me a little bit about when you see a patient coming in for anxiety. Let's say maybe we can have, an example with a patient that's coming in, maybe they're already on meds. They're maybe looking to kind of taper off of meds, or maybe they're just on stable doses, and yet their disease is progressing, or their symptoms are becoming more frequent. And then maybe an example of when a patient is coming in, maybe they're not on anything, and then you're kind of like starting from the beginning.
Yeah. So one of the things I like to begin with is we're talking now about adults. And so if you're talking about children may not know what helps them not be anxious, but adults often do. So the first thing I like to do is to inquire what's worked for you. And that reminds people that they already have a set of strategies that they can use. So for example, does going for a walk or a run quiet their nervous system? That's great. Does prayer make a difference for them? Does talking to someone they love make a difference for them? So I like to have people remember the things that they already know work for them. And sometimes we forget because we're feeling anxious and we're not using the tools that we already know and the things that resonate. So I always like to start there. What's worked for you in the past? And most people actually do know of a few things that help them. But as you said, for anxiety, there's such a large toolkit. So there are things we could do, mind, body, spirit, community. So, from the mind perspective, and, some of these maybe fit into more than one category, but can you reframe? So, for example, you're feeling anxious. Well, sometimes, and this just happened with a patient yesterday, she was telling me that she was feeling very anxious about a talk that she had to give that was coming up. But as we talked about, she was also super excited. So it's sometimes hard to go from, being very anxious to calming down. But to go from what we mostly consider negative, anxious, to being positive, excited, that's kind of at the same high valence. And so I recommended to her that when she started feeling anxious, could you say, well, I'm excited about this. I'm anticipating this. This is something I want to do. That won't work for everything. We're never excited about getting treated for cancer, right? But it is true for some of the things that make us anxious. It's actually a sign that it's important to us and it's something we want to pay attention to. Other mind things. I sometimes talk to my patients about what I call a mathematical formula, which is this, numerator and denominator. So at the numerator, you can think about what are the things that I'm overly worrying about, and at the denominator, what are the things that I actually can do to cope with this better? So, for example, if you live in Tucson, you see rattlesnakes. That's just part of living here. And you can really get into a fear state, an anxious state about the rattlesnakes. But you're probably overly worrying because rattlesnakes actually don't want to bite human beings. We're not their prey. They just want us to stay away from them. And the most likely person to be bitten actually is an adolescent male. And I'm sure you can guess why that is.
Oh, because they're going to be kind of peeking out.
Absolutely. Yeah, or wanting to pick them up,
Yeah.
So most, other people won't want to pick them up. And if you get rattled at, that's a sign you got to back up. You've gotten too close. So that set of, okay, how likely is it, or what can I do? But then there are ways also that you can work on your coping strategies, which could include, if you're walking when the light isn't great, carry a flashlight. Maybe don't hike on a trail where they're so camouflaged when they're most active, which would be in the summer. And reserve those trails for winter days when they're hibernating. So there are things you can do both to recognize that you may be overly worrying about something, and that's also fits into the cognitive behavioral strategies, cognitive behavioral therapies that we often use, or what can you do to better cope and make that thing you're worried about be less likely to happen. So those are some mind strategies. From the body, well, the vagus nerve, we can activate that as we talked about, but we could go for a walk, which for many people dissipates their excess adrenaline and makes them feel better. We could do yoga or Tai Chi. We could use breath work, which quiets the nervous system. We can, from the spiritual perspective, meditate. We can pray. We can use things like gratitude practice. So there's a wide range of things that we could do. And then from the communal perspective, I love this. Shelley Taylor's a researcher at UCLA, and she says that besides the fight or flight, women have this other way of managing stress, which is called tend and befriend. Because if you had babies or young children, you probably couldn't flee from the predator, and you probably couldn't fight. You were holding a baby. And so banding together with your friends, with the rest of your community, and tending those children and those relationships were what were going to help you survive in that kind of early evolutionary stages. And so we still have that reflex. So those are some of the things. So from a community perspective, talking to your friends, maybe attending a service that quiets you, maybe going to therapy. All of these things can be of value.
Yeah. And the tend and befriend, it's very interesting kind of how you see, again, like different people coping with anxiety. And as you pointed out, ask people what has worked for you. And there is this kind of ancient reflex of that for many of us. One thing that I wanted to ask you about, I find that sometimes, people, as we kind of go through maybe some of the mind-body modalities, for some people, it's so hard to sit still and meditate. It actually brings on more anxiety, right?
Yes.
What I often will do in that case, we'll certainly talk about exercise and dance, but I also just absolutely love the practice of that shaking dancing meditation that I learned about from Dr. James Gordon. And some of his work that he's done with his team with survivors of trauma and refugees and so forth. But usually for my patients who are, who tell me that that's kind of the response that they've had, it's like heightened anxiety with sitting still. I'll say, okay, great. Let's move into this, different strategy of really shaking it off. And I find that even sometimes for myself when, I don't want to be still. I've been sitting all day at my desk. I need a way to kind of release that energy. It can be so healing. And I think that does also come from ancient practices of dance and gathering and community.
Yeah. Thank you so much for bringing that up for a few reasons. One is, I just brought up a lot of different possible strategies, and I want to say nothing works for everyone, which is why it's great to have a lot of strategies, and nothing works at every time. So, for example, if I'm anxious going to sleep, I may not want to go for a fast walk, which is one of the things that helps me best. I want to go to sleep. I want something that's going to allow me to fall asleep. If I'm waiting for results in a doctor's office, fast walk isn't really available to me. I also have people who say breath work makes them anxious. They feel like they can't get a deep breath. So it's really great to know if something doesn't work for you, if something makes you feel more anxious, let it go. Work with something else. And I, too, have people for whom movement is the best strategy. And besides the shaking that Dr. Gordon teaches, Dr. Anne-Marie Chiasson at our fellowship teaches what she calls shaking the bones and putting on really lively music and just really shaking. Qigong, where you're moving energy, is one of those strategies. So there really are many, many strategies. And what I really want listeners to hear is if something isn't right for you, the good news is there are many other things that you can use. And actually, it's very helpful to have multiple things because if you're at Thanksgiving dinner and your family is not as healthy as you might have wished and you're uncomfortable, breathing quietly or using a mudra, which is finger movements, under the table that nobody is even seeing, could be really helpful. If you're about to have a procedure, being able to use one of the guided imagery as you're laying there and waiting for the operations with headphones, there's just really an enormous number of strategies. And the idea is you find the ones that resonate for you, and then you do them regularly. And by doing them regularly, you are entraining your nervous system. So the reason I use the Sensate regularly is because now when I put it on my chest, my body goes, oh, this is how I relax. And it very rapidly. Before I had that, I had binaural sounds that I listened to on Insight Timer. And my body entrained to those. When it heard those sounds, oh, this is how I drop off to sleep. So when you practice breathing exercises, your body learns to respond to that. Your vagus nerve more easily gets activated and goes into that quieting mode. So whatever you find that resonates, it doesn't mean you have to use it forever, but let's say for this duration of time, that's going to be your tool that you use to quiet your nervous system. And we haven't even gotten to supplements yet.
Exactly. Yes, exactly. And, just to really, share a little more about Insight Timer, I absolutely love that app because there are so many different focused meditations too. Mm-hmm. So let's say you're wanting a guided imagery or meditation while you're having a migraine. I actually used that on my son a while back when he was having more migraines, and there was a particular one that was really soothing to him. Mm-hmm. But then sometimes you might hear a voice and you might be like, no, I can't meditate to this voice. Right. It's not soothing for me. But this is the beauty of it. There are so many options, and you can really find the ones that again, your body is responsive to. And even they even have some high performance ones. So let's say you do have a talk the next day, or you're participating in an athletic event or something. There are the high performance ones as well. But so it really is such a kind of a jewel of meditation experiences that are available through that app.
Yes. I love that you brought up performance. We know many Olympic athletes. We just had the Olympics. Many other athletes use visualization before they compete. And they take themselves through this mental experience where they are performing perfectly. Every stroke or playing basketball or whatever it may be. And we can all do a little bit of that where we take ourselves through the thing that we want to do well. And so I think we have really underutilized the mind-body connection in medicine. We don't have pharmaceutical reps coming to our office and say, have you tried neurofeedback? Have you tried biofeedback? Have you heard about this new vagus nerve stimulating device? Have you fill in the blank? Do you know about Insight Timer? This is not something that most physicians necessarily incorporate into their practices, and yet they're free. They are health promoting, they are performance promoting, they are anxiety reducing, really wonderful tools to know about.
Yes, I agree. So let's dive into some additional tools like supplements and herbs. There are many out there. And, sometimes I hear physicians talk about supplements in a polarized way, right?
Yes.
All supplements are good versus all supplements are dangerous. There's no evidence for any single supplement. And so, with each conversation, I really like to be very specific and precise because I just don't like these blanket terms. I don't think they're accurate. And, I think it's really important to still acknowledge the modalities that can be helpful. And then areas where we do have to be cautious because, let's say, a supplement can cause liver enzyme elevations and we need to follow it up or it can interact. But I think that it's important to have nuance in these conversations because it's just simply not accurate to say, well, no supplement works and it's all marketing and it's all, or the other way around.
Yeah. Yeah. I appreciate that. I always think that it's good to begin with the larger context about supplements. And supplements include vitamins and minerals, and they include different kinds of herbal remedies and probiotics. So even the word supplements can mean a lot of different things. And I think they're relevant. They're very relevant in a conversation about anxiety because we are not all alike. And so, for example, sometimes we don't eat a perfectly healthy diet and we don't get all of the micronutrients that would help us be healthy. Now, of course, step one is eating a healthy diet. And I didn't mention that when I was talking about the body, but diet factors into anxiety as well. We know, for example, if we drink too much caffeine, we may feel anxious. Some people have that from aspartame, which is one of the artificial sweeteners. It can be broken down into these amino acids, which are stimulating and can make people feel bad. So diet matters as well. But with supplements, if there's gaps in the diet, sometimes supplements can help fill those gaps. Some of us are different in the sense that we're genetically different, and we actually need more B vitamins to make our neurotransmitters work as effectively as possible. And we need more than we could easily get in the diet. Omega-3 fatty acids, which come from eating fish. Well, someone may be vegan or vegetarian and not getting enough omega-3s in their diet. So there are ways in which the supplements can fill gaps. They can address people who have SNPs, which are these single nucleotide polymorphisms, which will mean that people need more for the optimal functioning of their nervous system. And the last thing I want to say before we dive into the specifics is that while I totally agree, and I said this earlier, anything that has the potential for benefit probably has some potential for harm. Generally speaking, supplements are safer than the medications we use, which are the antidepressants and the benzodiazepines, which have a lot of potential side effects and can be very hard to get off of. That was one of the classes of people that you brought up as a potential issue. So what is it? What are the things that can be used? I like to distinguish between things that you would take all the time. Now, again, that doesn't mean your whole life, but it means not just on an as needed. I feel anxious this evening. I want something that will help me a little bit. Maybe I'll have a cup of kava tea versus something you're going to be taking every day for a while. So B vitamins, as an example, is something that you might be taking every day for a while. And I usually recommend that people start, it's wonderful to be directed by an integrative medicine physician or a naturopathic physician. But if you don't have that at hand, you start with a B50 because that's going to be all 8 B vitamins at a level of either 50 micrograms or 50 milligrams. And you see whether that indeed helps. It's often important in the production of neurotransmitters, including serotonin, which are going to be helpful to help stabilize your nervous system. So, and doing an experiment where you see whether a steady dose of B vitamins is helpful. Yes, you can get too much, and we can check your B6 level, which is what we worry about the most. We could check your B12 level. But beginning with B vitamins, and these have been studied, they've been studied in about a dozen randomized controlled trials in people who were stressed or anxious, in people who are depressed, and people who were at risk for PTSD. and they've been found to be effective. So they're a well-studied dietary supplement. And I don't know if you have something you want to add to that B vitamin conversation.
Yeah, definitely. So in our case, I mean, we do check levels before and after, but I agree with you that I think sometimes if the person doesn't have the ability to check, doing that empiric trial and then reassessing a month or two later, reassessing have things changed and ideally tracking, that's absolutely a conversation I have because B6, for some reason, supplement companies tend to add not just super physiologic doses, but like 100x super physiologic doses to their B6 to their supplements. And so it's not uncommon that I'll find a level to be, you know, approaching 100 or sometimes even above 100 where we really have to stop. And then I'll still supplement the others if I need to. But then I have them take a break from B6 specifically. And then our gut microbiome can also make some B vitamins as well. So I think we just have to be cognizant of how much we're getting in total. But sometimes, absolutely, that empiric trial and just knowing what are we testing, where's the baseline, and then what outcomes are we assessing afterwards.
Yeah, I totally agree. When I see a patient, I ask them to bring in all their supplements. And when you look at the label, you see, as you said, B6 added. And when you count up how many milligrams they're getting across all the supplements, sometimes it is in a dangerous level. And so then it's like, well, you know, which of these supplements are most beneficial to you because you're getting too much B6. And so that is something that people can count for themselves. Certainly you do not want more than 100, but sometimes you really want to make sure you stick closer to 50. And if your B6 is elevated, then you may have to go off of B6 entirely. I completely agree with you.
Exactly.
The next thing I sometimes have people take regularly are omega-3 fatty acids. So these usually come from fish. We sometimes call it fish oil. They can actually be from algae as well, which is how fish make the omega-3s, by eating algae. So the manufacturers have now made algae-based ones for people who are vegan or vegetarian. They need to be taken in a sufficient amount. When you look at the meta-analyses, which are the studies of the studies, you'll see that when people take too little, it doesn't work on anxiety. When they take 2 grams a day of EPA plus DHA, it works. Now, to know if it's 2 grams of EPA and DHA, you have to look at the back of the label because the front will say 1 gram of fish oil. But that may not be EPA and DHA. It may be ALA. It may be other kinds of oils. And so you really have to pay careful attention to the EPA and DHA on the back of the label. And it'll almost certainly be several capsules. So it's not a small amount. It's very anti-inflammatory. It has been shown in studies to help with anxiety. This is also something that you now can have a lab test for. It's called an omega index, and it'll show if you have enough omega-3 in your body. You don't have to take a supplement. People who eat a lot of fish often do have enough omega-3. People who don't like fish or they eat tilapia, for example, which is an omega-6 rather than an omega-3 fish. The omega-3 fishes are what we call SMASH. That's the acronym. So that's salmon, mackerel, anchovies, sardines, and herring. Those are rich. All of those are rich in omega-3s. There are others like black cod. So that can be very helpful. We also recommend increased omega-3 to people who have inflammatory conditions like rheumatoid arthritis or ulcerative colitis. There's some suggestion that it may help reduce risk of things like Alzheimer's. So in general, you get some what I like to call side benefits from taking omega-3. But there is also some potential risk, which is in people as they get older, there is some evidence that it can increase the risk of atrial fibrillation. So if you're a young person, probably safe to go ahead and use omega-3 for your anxiety. If you're someone who's maybe 55 and older, probably want to have a conversation with your doctor.
Agreed.
What would you add?
Definitely. Yes, I agree. Definitely. It's so interesting about omega-3s and atrial fibrillation because studies show that if you're getting omega-3s from food, that there's actually potentially a reduced risk of atrial fibrillation. But if you're getting it from supplements, there's increase. And then to your point, just in case anybody listening is curious, to your point about looking at the label for EPA and DHA specifically, it's because some of the other forms, so for example, ALA, which is another form of omega-3, it very inefficiently converts to EPA and DHA, less than 10% in the body. So it's absolutely essential to look at those amounts. And then that's something that I also check in my practice to assess, okay, do we need to go up on the dose? Do we stay? And then the one other thing, and generally with low doses, it's not a concern, but if somebody is at the 4 grams a day, which I typically don't have patients at that dose, but if they are, then I would have them stop it before surgery, certainly,
right,
because of any potential bleeding risk. But I haven't had at lower doses any increased bruising or bleeding in my patients, so it doesn't seem to be an issue.
Great. So some of the things I use in the short term, and I'm curious how much our lists overlap. I really like L-theanine. L-theanine comes from green tea, and it is an amino acid. It promotes relaxation. It doesn't sedate people. The dose, it can be as little as 100 milligrams in a day, as much as 400 milligrams. It is a wonderful thing that you can purchase. You don't need a prescription. It's not addictive. It is considered very safe. It probably affects our neurotransmitters, increasing GABA, serotonin. And this is for short-term use. This is, I'm going through a rough patch. You could use it every day for a while. And I find it a very effective tool that people can use on an as-needed basis. How about you?
Yes, agreed. Yes, L-theanine is one of the ones I use as well, yeah.
Yeah. Another one I really like, I'll tell a little patient story. I recently had a patient contact me. She was, this is so strange, but not uncommon. She's living in an apartment and she could hear her downstairs neighbor snoring. It wasn't well insulated. And it had gotten her in this terrible state where she just couldn't sleep. And she's like, I'm doing everything. I put down, rugs in my apartment. I have the best earplugs, that I put in my ears at night, but I can't wear them all night because they're not comfortable. I listen to noise blocking, and really, I think she had gotten herself what I would call hypervigilant. Mm-hmm. And so it was almost like she was waiting for that snore to begin and affect her sleep. So I recommended inositol to her. Inositol is something that people sometimes call vitamin B8. It is something you take as a powder because you actually take pretty big dose of it. You do it by the spoonful rather than a capsule. If you get capsules, you'll go through a lot of it. But I find it really helps when people are hypervigilant, can't sleep well, and you take it before bed. It's slightly sweet. It's just a tiny bit gritty. You mix it into a little liquid. It has also been studied and shown to be effective in people with panic disorder. I didn't mention earlier, but L-theanine has been studied and shown to be effective. And so this is something I really like for people who are in that hypervigilant state. Also, one other thing, it's safe in children, so you can use a little bit in children as well.
Mm-hmm, mm-hmm. That's interesting. So it's so interesting. I have used inositol for anxiety, but I use it more commonly in PCOS. Which oftentimes people with PCOS will also have anxiety.
Yeah.
And yeah, it's very easily tolerable. The taste is, like I said, just a little bit sweet. So that's kind of the context because it has some of that evidence for reducing testosterone levels and improving ovulation. But you're absolutely right. I really should use it more in anxiety as well.
Well, especially, like I said, people who can't sleep because they're just, it's like, if any of your listeners, this was true for me, when you have a baby and you're sleeping and listening for them to cry at the same time, that's what that hypervigilant, you can't really sink into deep sleep, which of course we need. That's what our, nourishing sleep is about. I'll throw out another one, lavender. So lavender is a plant that has a wonderful aroma. We use it as aromatherapy, and you can get some essential oil, put it in an atomizer and smell it. But actually, this is one of the few essential oils that's been turned into a pill that you would take by mouth. And so there is a product called Selexin. It has been studied in many, many studies, and it's sold as a dietary supplement now. And it also has been shown to be very effective for use as needed for anxiety. Is that one that you use?
It is, yes. I'm just trying to think. Is Selexin in Lavella? Lavella
yes,
is the one
it
that I
is.
use often.
Yes,
and then
correct.
Sometimes I'll use it as if people prefer not to use the pill.
Yes.
Sometimes I'll use the Herb Farm dropper. Yeah.
Yes, it is. So, those are a few. The reality is there's a whole category of botanicals that are sometimes called nervines, which help with the nerves. And they can include passion flower and hops and all of these different valerian, all of these different botanicals. Sometimes they're mixed in an extract where they're put together and they can have synergistic effect, and those can be helpful as well. So the reality is that there's really a wide range of different kinds of supplements that can be used, but the ones we've just talked about are some of the most common ones that I find effective.
Yes, absolutely. And do you tend to, stack them if you're not getting sufficient results, or are there some in particular that you like to combine with others or that you don't like to mix?
Yeah, great question. So I do like with someone who has more of a generalized anxiety disorder or someone who's on medicine and wants to see if they can taper, and you have to taper the medicines very slowly. That's probably not for today's conversation because I only have about 5-10 minutes left. But make sure you taper slowly when you're going off of any kind of medicine. Work with your doctor or your psychiatrist to do that carefully. But I do like people who have more of a chronic anxiety problems to be on the B vitamins and the omega-3s as a foundation. And then I'll add to that with other ways. But I won't just be adding supplements. I think it's really important that we think about people's diet, their sleep, their physical movement, their breath work, ways to quiet the vagus nerve, and looking at that whole package, which is what integrative medicine is so fabulous at. What is the synergism of these various approaches to quiet the nervous system? And the other thing I'd say about that is that when we give people a pill, and this is true whether it's a prescription medication or whether we tell them take L-theanine, there's a way in which we're suggesting to them that they need our medicine to get well. When we teach people skills, whether that's quieting their nervous system, whether that's using cognitive behavioral therapy, or any of the other things we've talked about, we are saying, I have faith that you have the capacity to recover from this particular challenge that you're facing. I know that you have this innate ability, that you have within you the systems that will allow you to heal and flourish and that don't actually require medicine, which isn't to say one should never use medicine or dietary supplements. It's fine, but it's really great to strengthen the innate capacity to heal that's within all of us.
I'm so glad you said that. I think that's absolutely true. And this is where that agency comes in, and
Yes.
that kind of self-reliance. And,
Yes.
And where that can really grow. Like you said, if we have these habits, these tools that we're using, and insight into what works, that'll positively reinforce itself and certainly help with the course of the symptoms and that deeper healing that needs to happen.
Beautifully said.
Well, thank you, Victoria, so much. I'm so grateful that we've had this opportunity and got to really unpack the integrative approaches to anxiety. Thank you so much again for your time.
BOJANA, it's a pleasure to be with you. Thank you for having me, and just well wishes for everyone who's listening.
All information in this video, including but not limited to the video itself, the audio, text, graphics, images, and other material contained in this video, is strictly for informational purposes only. The content is not intended to serve as or be a substitute for professional medical, pediatric, or psychiatric advice, nor is it designed to suggest any specific diagnoses or treatment. Please always seek medical advice from your physician or qualified healthcare provider regarding any medical conditions, questions, or treatment, particularly before making any changes to your healthcare regimen, medications, or lifestyle habits. Never disregard professional medical advice or delay seeking help from a healthcare provider due to something you have heard, seen, or read in this video or audio. Reliance on any information in this video or audio specifically applied to your own case is solely at your own risk.